Welcome to our new episode of the Ocular Insider podcast, which we record here in Italy, in Sicily. And I'm very proud to welcome Dr. Pavol Veselý from Bratislava. And let me say hello.
Hello. Thank you very much for your kind invitation. So at the beginning, let me introduce myself. My name is Pavol Veselý and I live in Bratislava. I'm a founder and chief medical officer of VESELY Eye Clinic, which is a chain of clinics. My specialty is cornea, refractive surgery, lens surgery, and corneal transplant. And here today we are about to speak dry eyes and refractive surgery and what to do and how to do. So, do you have any questions for me?
What is actually the big obstacle you see in doing surgeries and dry eye?
Okay, the obstacle is dry eye, but the question is, why do we have so many dry eye patients these days? So, and especially in the age group of 20 to 30, 35 years. And we need to search in our civilization. We know that people work extremely much with computers, laptops, telephones, tablets. They stay in dry environment, offices that are dusty and dirty. And this all actually has a huge influence to the dry eye syndrome. And yes, even these people, unfortunate people who suffer with dry eye, do have refractive errors and want to have their surgery done. And then when we find out that they have not only the refractive error but also a dry eye syndrome, we need to fix the dry eye syndrome first, and only then we can proceed with the surgery. There are certain steps that actually not need to be followed, but there are steps that we do follow, and only after the patient takes all the steps on the way, is eligible in our facilities to undertake the surgery he would like to have.
Sounds really interesting because I'm sure you will be not the only one who is facing this, and maybe you have some special advice to our listeners out there, to the audience. Any special recommendation from your side?
Yes, be very careful with the eye exam and pay much attention or more attention to the tear film, to the conjunctiva, to the cornea itself. And if you find out something is not absolutely well, we are very fortunate today that we have devices. We can substitute the missing parts of the tear film with artificial tears that can help us. So what we do in our facilities, we always do an tear film analysis before almost every kind of surgery, especially refractive surgery. And only if the tear film gets into a standard or normal conditions, is the patient eligible for the surgery. And sometimes it's very challenging. Sometimes it takes a lot of time, but it's worth it because you want to treat patient that is ready for the surgery and you don't want to undertake any risks. And tear film deficiency is a huge risk in the successful result of the surgery.
I'm 100% with you, and I really like this way how you deal with it because I'm sure it also works in the patient satisfaction rate.
Yes, it is true. I mean, we know that actually the patient satisfaction is the engine of our success. The more our patients are satisfied, the better the word of mouth we have. And you don't want to waste your name and your good name and good experiences of your patients by failing in a thing that is actually treatable. And I believe the tear film insufficiency is treatable, although in a long shot, but still it is. And this is not applicable only for the laser refractive surgeries. We do care about the tear film also when indicating the so-called multifocal lenses or the full range of vision lenses, where the quality of the tear film and the smoothness of cornea is also very important. What I explain, or how I explain it to my patient, is like, imagine you are on an ice rink after a hockey game. The ice is scratched from the skates, and this is what the cornea looks like without the tear film on. And only you need a Zamboni to go over the ice during the break, and the Zamboni actually puts a very tiny film of water on the scratched eyes, and then the eyes is nice and smooth. And this is exactly the function of tears, to make the surface of the cornea very smooth. And then the patient would understand easier what is the problem and why the problem must be treated before they get their trifocal lens implanted into their eye. This example is actually leading them to understand the problem. And once the problem is understood, they are cooperating much better, and they do understand why they have to undertake this, that, or whatever kind of treatment to have their dry eye syndrome fixed or improved.
So you have now really a long time experience on these dry eye patients before they undergo a surgery. From my side, it would be interesting to see, when do you think, if you think back to the older days, had started to be more important, to become more important, to take care about this dry eye, including surgery process?
Already in the past, far past, we had patients coming back that, let's talk about the trifocal lenses or the full range of vision lenses, who were coming back, and they were complaining that they don't see well, but we saw nothing on the eye really. Only thanks to the new diagnostic devices we are able to define what the problem is. And logically, when you can define the problem, you can pay attention to the problem. So I believe the extreme change in approach was coming with the change of diagnostics tools that were available.
Thank you for all your insights. Thank you for all your inspiring words. What I really like is the image you painted in my mind when you explained the scratches on the eyes. So that's really helpful, because I think these are also wordings who can be used from anybody outside in this world to explain, to make it visible for a patient to understand where the issue is coming from. So thanks a lot for your time.
Thank you very much for the invitation. And I have to add one thing. The more the patient understands the problem, the better the patient cooperates. That's why I'm trying always to use these very picturesque things that people can imagine. Thank you very much for your invitation. It was very nice talking to you.